Do you experience leaking with sneezing, coughing, laughing? Maybe you have constipation or even low back or hip pain. These are just a few signs that you may have a tight or overactive pelvic floor. So when we have a tight or overactive pelvic floor, the pelvic floor muscles tend to be in a tense or contracted position. And with that, weakness goes hand in hand. A tight pelvic floor does not necessarily mean that it is strong. It is often weak, but doing Kegels initially can make symptoms worse. So just a few signs that you may have a tight pelvic floor include maybe even difficulty starting to pee or feeling like you get that second stream of urine after you go, constipation, urinary leakage, so leaking when you sneeze, cough, laugh, or exercise, pain with penetration, or maybe you notice you can't get a good pelvic floor contraction when you try and do it, difficulty getting in a full deep breath. So when you try and practice that deep breathing and you feel like your inhalation hits a wall and you cannot get a good deep breath in, your pelvic floor may be tight, and even low back, hip, or SI joint pain. So what do you do if you think you may have a tight pelvic floor or you're experiencing some of those symptoms? Number one, I recommend getting an evaluation by a pelvic floor specialist so that you can get an individualized plan going that is good for you. Some other techniques that I often prescribe are deep breathing, so practicing a few times a day, taking those big deep breaths in, letting that pelvic floor relax and drop down, and then stretches that also help relax your pelvic floor. So child's pose exercise, happy baby, any kind of stretches that you can hang out in, let that pelvic floor relax, and do some deep breathing in. If you've had a C-section and your scar is healed and you are ready to do scar tissue massage, releasing some of that scar tissue and massaging that area can also help reduce the tension and the pressure going down onto your pelvic floor, and also strengthening the areas around the pelvic floor muscles. So strengthening your hips can help reduce the strain on your pelvic floor and reduce the tension. And a lot of times it's not just a pelvic floor issue, which is why we have to look at everything. So a lot of things that I'll look at in an evaluation is our breathing, our posture, our core engagement, our hip mobility, our hip strength, and just our movement as a whole, from everything down to the head, from the head down to the toes.